And Oregon's latest restrictions set to go into effect tomorrow. It will close gyms, reduce capacity of businesses, and it changes how restaurants operate.
The freeze is expected to last at least 2 weeks in the state, a full month in hotspots like Multnomah County. Clackamas County Health Officer Dr. Sarah Present is live with us this morning to break down some of the latest data. Good morning, doctor. Thanks for joining us.
Good morning. Thank you for having me.
Of course. So first, let's start off with just a look at Clackamas County. Where are you seeing surges right now? How is your hospital capacity? Give us a picture of what you're dealing with.
Absolutely. So Clackamas County is absolutely following the same trends that the rest of Oregon is, and we really need to shift gears right now to get these numbers under control. Over the summer weeks, Clackamas was averaging about 100 to 150 cases per week. Starting in October, we hit 200, and this last week we had 676 cases in a week, which is more than a tripling over 3 weeks. Our hospitalizations are increasing, and we know that the hospitals in the region are stressed. So now is absolutely the time for us all to shift gears and try to get these numbers under control.
Well, no,
just one more thing at this point, I want everybody to know that our public health system is also getting overwhelmed by these numbers, and many people are not getting the contact tracing calls that that we have been so diligent and so successful in before.
Yeah, sorry to interrupt you there, but I just wanted to ask, earlier in this pandemic, Multnomah, Washington, and Clackamas counties were kind of together in terms of what we did to combat COVID-19. Is that still the case? And are you part of the 4-week freeze, or will it be 2 weeks in Clackamas County?
Absolutely. So as the Clackamas County Public Health Officer, I work very closely with the Multnomah County and the Washington County Public Health Officers. And I know that we all have the similar struggles with controlling our numbers, similar types of spread as far as spread amongst social gatherings and work sites, and similar approaches to how we recommend the public health response is. As far as how long we'll be in this freeze, it really depends on the numbers. If we make a big turnaround and start seeing these numbers decline, then we can start looking at what restrictions we can start to lift. But if we don't see a turnaround, then I think that we need to maintain these more strict precautions until we do.
So just clarifying this, are you looking at 2 weeks now, or are you looking at 4 weeks at this point?
So the statewide governor's order is for 2 weeks. We are going to see what happens in these next 2 weeks, and then we'll make decisions as we need to. But I can say that if we don't do something and get our numbers to turn around, we may be looking at longer.
Yeah. Now, there's a question of over the next 2 weeks here, how we're going to be enforcing this freeze. A lot of people wondering to what extent law enforcement might be involved. What kind of conversations have you had about the actual enforcement here?
So we in public health are really looking at the numbers and our public health approaches, which are to communicate what everybody individually can do. We're really looking at our holidays coming up. We have Thanksgiving coming up. And my role as the county public health officer is to encourage you to really look at your social gatherings, at your holiday plans, and personally take all of the precautions that each individual can take. And that can make an effect. As far as enforcement, there are many conversations around that I don't know all the outcomes, but what we need to do as a public health tool is for each individual to take the precautions that they can to limit their social gatherings. If you are going to be gathering, make it as safe as possible and as small as possible. Outdoor is better, and really try to limit your gatherings to those that are in your household.
What's your testing situation there?
So we have definitely increased the capacity for testing throughout Clackamas as well as the Portland metro region. As the numbers increase, the demand for testing also increases. Similar to how as the number increases, demand for hospitalization increases. All of these put a strain on the healthcare system and the supply chain system. I have heard that there may be some limitations in some health systems on the testing, but right now everyone should be able to find a test if they need it. If you have symptoms, we encourage you to connect with your medical provider and talk to them about getting tested.
All right. Well, Clackamas County Health Officer Dr. Sarah Present, we appreciate your time this morning. I'm sure we'll be checking back in with you over the next few weeks here. Thank you again.